Well, hi everyone. I'm Whitney Knauer. I'm a veterinarian over at the vet school. I've been on faculty for a couple years now and do a lot with sheep and goats and teaching our veterinary students how to be competent small ruminant veterinarians. So I was asked to talk about flock and herd health as it relates to preparing for the breeding season. So the things that I'm choosing to focus on here, so we're going to talk about ensuring health, which is a big topic in your use of dose, and Kyle set me up really well for a few of the things that I'm going to be talking about. Then we're going to talk about the breeding soundness exam for the males, really getting males ready. And then a little bit about biosecurity. So this is the time of year, especially if you're purchasing rams or bucks, that we have a real opportunity to do some things to prevent the introduction of disease on your operation. So first thing here we're going to talk about is ensuring health. And so Kyle already talked about monitoring body condition. He talked about flushing. So we're not going to talk about that, but we are going to talk about vaccine considerations, parasite control very briefly, and then culling. Because if we think about it, ewes and does, they need to get pregnant, right? Where we want them to get pregnant. We want them to maintain their pregnancy. We want them to make good colostrum, and we want them to make milk. So we have to set them up for success in all those things. So when we think about vaccines, the vaccines that we would give at this time of year pre-breeding would be the vaccines that are associated with abortion. And so this is a vaccine, so the core vaccine, which we'll talk about in a few slides for all sheep and goats and camelids for that matter, is CDNT. So the Clostridium perfringens type C and D and tetanus. So that's all animals all the time need to be getting that vaccine yearly. But when we think about other risks, one of the risks that we might have is abortion or the reproductive abortion agents. And so this is something that you would want to discuss with your veterinarian. You wouldn't want to just start vaccinating for these things because typically we don't want to, first of all, spend money when we don't need to, or vaccinate without having a disease pressure. So what are the risks for introducing these agents? Having an open flock. So we'll talk a little bit later about what that actually means, but really if we're having animals coming in and no biosecurity, no testing surrounding them, feeding on the ground, so giving our sheep and goats opportunities to do things like eat placentas, and then certainly if we have a history of herd or flock abortion. And the two big ones here, or the ones actually that we have vaccines available for, are Campylobacter fetus, which is often called Vibrio, and this is an agent which causes late-term abortion or stillbirth. And it's cyclical. So this is a disease that comes around, it's usually in your herd or flock, and it comes around every 4 or 5 years and causes pretty big reproductive losses. And then the other one is Chlamydia abortus. And so you might have heard this referred to as EAE, or enzootic abortion of ewes. And this, again, abortions typically happen in the last 2 to 3 weeks of gestation, or you might have stillbirths, or you might have weak lambs or kids. Rams can be affected in this case and can actually transmit from ewe to ewe or from doe to doe. And the reason for that is because animals, once they are infected for life, or at least a long time, and they actually shed around ovulation. So they shed this bacteria in the 2 to 3 days around ovulation. So if we have these in our herd or flock, we can vaccinate for them. And so there are two, so the Colorado Serum Company and Hygieia, which has sometimes has availability, sometimes doesn't, both make a vaccine for Campylobacter. And this is typically a vaccine that we're going to be giving pre-breeding. So before we put our ram or buck in, we're going to be giving it. And then at some later time, so we either, based on the recommendations of that vaccine, whether it's in 60 days or mid-gestation. And what this vaccine does is it prevents abortion loss. So it's pretty small, apologize for that, but this is some data from a vaccine trial where they had two groups of animals. They vaccinated one group and they did not vaccinate the other. And then they challenged them with Campylobacter. So they infected them. And they found that animals that were vaccinated had no reproductive loss, and animals that weren't had nine abortions. So this vaccine works if you have Campylobacter in your herd. The second here is chlamydia. And so again, this is enzootic abortion of ewes. There's one product, and this is a product. So if you're already, you're putting your rams in tomorrow, you're already too late. So this is one where we give 60 days prior to putting our rams or our buck in, and then boosting 30 days later, and then an annual revaccination. And so this is one that actually doesn't reduce, it will reduce abortion, but it won't necessarily eliminate abortion. So probably maybe more important than knowing anything about these vaccines is as we're getting ready to go into breeding season, or maybe we're already there if we're breeding for December lambs, being aware of what are the things that would clue you into whether or not you have an abortion problem. And when we think about, this is one of the really good reasons to use a marking harness. So this is a ewe who must have been bred on the first cycle because she's got a yellow mark there. But if we have a remarking rate of more than 10% or remating after a delay, so Kyle was talking about that buck that didn't really do a very good job. Well, he did it. He thought he was doing a great job, and he bred everyone, but it turns out that he was infertile. So if we get a lot of remarking, that can be indicative of an abortion problem. And this is also a reason why record keeping, especially for reproductive performance, is really important. If we have no kid or lamb at when we think we should, despite a positive pregnancy diagnosis, so this is a reason that it would be good to ultrasound to get your vet out and actually know how many animals are pregnant, so you can plan for lambing. And then, blood tinged discharge, but no placenta or fetus found. If we have preterm fetuses, so again, this is another reason why having breeding dates would be really good, because we can tell when our lambs or our kids are going to be due. So less than 142 days is considered early. And really, what's normal? So normal herds and flocks, we have less than 2% abortion rate. And typically we say between 2 and 5%, typically we say that there's an endemic disease within the herd. So you're infected, but it's not what we would call an abortion storm or a big problem. And if we're above 5%, that would be a reason to investigate, intervene. And there are other things that we can do other than vaccinate. So certainly this is when you would get your vet out and get some intervention there. But I think that what this highlights, maybe this isn't a problem on your herd or flock, but knowing kind of the things that you would be kind of clued into as you move forward and as you start breeding animals to understand if you might be tending towards a potential problem. And then, let's see, there we go. And then our core vaccine. So our CDNT, so this is Clostridium perfringens type C and D, and then tetanus. And so this is the vaccine that we want to be thinking about giving to our buck before he goes out, or our ram before he goes out with ewes and does. And that's a yearly vaccine. And then the other important consideration is I have kids there because we want to be thinking about providing antibodies to those kids when they're born. And the way we do that is through vaccination of mom 30 days prior to kidding and lambing, so that there are antibodies in the colostrum, or that first milk that mom makes. And so the graphic on the right is just kind of demonstrating that. I know a lot of producers vaccinate like day-old kids or day-old lambs, but really the way to that really actually doesn't work. Those animals are not going to mount an immune response. And so what we want to do, start thinking about is getting that CDNT in the refrigerator. So it's available 30 days prior to the start of lambing or kidding. And so this graphic, so this is the ewes, so there are the red line there are the ewes that are vaccinated 3 weeks prior to lambing. And then there's a group, so they had 2 groups, and there's a group here down here that's not vaccinated. And then this line, this red line, are the antibodies that the lambs that drank the colostrum of vaccinated ewes. And then the other line are animals, are lambs that are vaccinated at birth. And so this is sort of early for talking about CDNT and vaccinating pre-lambing or kidding, but it's that important, I think, that I wanted to mention it. So that's vaccines. What about parasite control? And so parasite burden is a challenge, especially when we're talking about Haemonchus contortus. It's associated with lower body condition scores. And then kind of if we think about all of the downstream bad effects that we can have from having low body condition animals. So that can translate into reduced reproductive performance. We can have lower birth weight offspring. We can have lower milk production. And then if we think about like a year from now, or maybe, I don't know, 9 months from now, we think about pasture burden and pasture parasite burden, and we want to kind of be preemptive in thinking about that. And so this is the only thing that I'm going to say about that, is that we want to think about deworming, and deworming's targeted selective deworming, so individual animals that need it. And if you're interested, email me. I can refer you to an entire presentation about it. And that's, I think, what I'm going to say. So we can, we use famotidine, and that's related to Haemonchus. But that's something that we want to be looking at this time. And then the last thing I'm going to talk about as it relates to health are culling decisions. And so typically, if we're thinking about weaning, which we might have done a few months ago, or we might still have lambs on ewes at this time of year, typically those are decisions that get made when kids or lambs are pulled, and this is the time of year to do it. And so we want to set ourselves up for success next year. And how do we do that? Well, we get rid of animals that aren't going to be successful. Or, if you're a small herder flock, it might be just a decision not to breed an animal. Maybe you have animals that are more pets than production, which is fine and great, but it might be an animal that you don't want to breed next year. And so how do we make that decision? Well, we can think about body conditions, so evaluate that. Milk production, how did those animals wean lambs and wean kids? Were they up to par with all the rest of the kids and lambs? We can think about conformation. We can think about udder conformation. So is it a ewe with a saggy udder with teats that are hard to drink out of? We can think about age. So if we're creeping up above 7 or 8 years old, we might have reduced reproductive performance, reduced ability to make milk in the next lactation. And then disease status is another thing that we would want to consider. So I think it's especially important this time of year, because we really don't want to put time and effort into animals to breed them if they're not going to be successful, or they're going to have poor success raising lambs or kids. All right, so that's the first topic. Second topic that we're going to discuss is the breeding soundness exam. And so some of you might be really familiar with this, some of you might not at all be. So we're going to kind of go through it as kind of the when, why, how, and what of the breeding soundness exam. And so, Kyle mentioned that this is one of the most important things for reproductive success in a herd or flock. And what we're really doing here is we're testing the potential of a male to be successful reproductively. And so if we think about these are some polypay ram lambs there. You know, how are we going to decide which ones we're going to use? Are they all equal? And I also want to mention, so you'll notice that these guys actually, guys have wool on their testicles. So Kyle mentioned shearing. We also want to make sure that we shear testicles because heat is inversely related to sperm count. And so that can reduce your reproductive capacity. So don't forget to shave testicles. All right, so there's some data out there that, you know, anywhere between from 10 to 30% of bucks and rams are unsatisfactory breeders. So if we're not evaluating them, we're really missing an opportunity, and we might be shooting ourselves in the foot as far as, you know, getting our ewes bred. So if we're thinking about satisfactory animals, what is that going to do? So if we have an animal who is going to be reproductively successful, that's going to shorten our lambing or our kidding window. It's going to potentially increase that ewe to ram ratio. So we might be able to go from 1 to 50 to 1 to 75, for example. We're definitely going to have fewer open ewes and does, and potentially a higher percentage lamb or kid crop. So it's kind of like a win-win-win-win to do these. And so so here's some dollars for you. So this is one study, so we always have to use caution when we're just looking at one individual study on one flock. But this study, they found that when they were only using satisfactory animals, they actually increased profitability by between $20 to $25 per ewe. So that's a pretty big deal. Okay, so what are we actually doing when we do a breeding soundness exam? So we evaluate kind of we do a physical exam, we look at conformation. There's a reproductive tract, external reproductive tract exam, and then a semen evaluation. So the other thing to remember is that this is kind of, or it is a snapshot in time. So it's not a guarantee of fertility, but it's an assessment of likelihood. And the picture or the document there on the right-hand side, that is kind of all the things that we, you know, as veterinarians would fill out, but then you would get that to look at and to keep as kind of documentation of your ram or your buck's evaluation. And when we think about, so here is the classification here on the lower right-hand side. And so some people will go ahead and call animals excellent potential. The Society for Theriogenology, which is the veterinarians who are experts in reproduction, they want to hedge their bets a little bit more than that. And so they will just go with satisfactory, unsatisfactory, and then classification deferred. So really it's just satisfactory, unsatisfactory. And what does that mean? Well, what that means is that for a satisfactory animal, they will be able to service 50 to 75 ewes or does in one cycle, so in 17 days. So I'm just going to walk through like a couple examples of what we would be looking for. And also I will mention, so I work a lot with dairy goats, and I will say that almost no one does breeding soundness exams for their dairy bucks, which is a real missed opportunity in my mind. I remember being on a goat dairy a couple years back now with a producer, and the buck had a scur, and we were gonna, which is a wonky horn, and so we were gonna cut it off, and we were going to look at this buck, and you know, somebody was like, oh, let's see if he's got 2 testicles, and in fact he only had 1. And these people paid a lot of money for this buck. And so if the BSE would have happened, that could have been sort of a pre-purchase thing that they would have found. And so again, I think there's an opportunity in the dairy goat world. Anyway, this is a dairy goat. So this is a Nubian who I looked at last week. And he's got a lot of libido. He's a really good breeder. But he's really accident prone. So this animal, I don't know if you can tell, but he's got a bunch of swelling in his armpit here. And so that's something that we would look at. We would look for, you know, feet and legs. We would look for are they lame? Are they able to walk normally? We would look at their toes. We would you know, either trim their feet or suggest that their feet might need to be trimmed. Another thing that seems silly, but it's pretty necessary for ability to breed is we want to make sure that they can see, right? They need to be able to see the ewes and the does in heat. So, and you can tell he's kind of sitting a little hunched up, and he's actually a little skinny. So body condition on him is lower than we would want it. Another thing, so this is actually, so someone asked a question about pygmy goats being teasers. So this is a pygmy who is a teaser for a boar goat herd that does a lot of artificial insemination and ET work. And he does a really great job in finding those animals in heat. And he's had 2 vasectomies because the first one didn't quite stick. So the other thing that we do, so we evaluate the testicles in the scrotum. And so we palpate those, and if we palpated him, we would feel lots of lumps and bumps. And so that's what we're feeling for, to make sure that we don't feel those, because that reduces their ability to have normal sperm. The other thing that we do is we measure the size of the scrotum. And so especially in sheep and goats, the size of the scrotum and the testicles within the scrotum is very correlated with semen output and fertility. And so that's something else that we would do. Looking at the penis itself, so to make sure that there are no abnormalities. This is a ram who that is not normal. So he had, I think what happened here, it's either genetic or he was rowdy and was housed next to some potentially females in heat. He tried to breed him through the fence, and he injured his penis. So that's something else that we would look for, because that will influence an animal's ability to breed. And then the last thing we do is we electroejaculate them. And so then we have a sample of their semen and we look at it. We look at it in a couple different ways. We'll look at motility, just kind of on a macroscopic scale. So we see basically how fast it's moving. We grade it like fast, not so fast, and slow. And then we also look at the sperm themselves to make sure that they're normal, and to make sure that there not a lot of them that are potentially damaged, and which would mean that they wouldn't be able to swim to the eggs. So that's kind of the 3 things that we look at. So we look at kind of the physical exam of the animal. We do an external evaluation of scrotum and penis, and then we look at semen. And from there, we say, okay, they're satisfactory, they're not satisfactory. And so now so when would we do this? So Kyle mentioned this, so this should be performed at least 30 days prior to turnout, ideally more than that. So ideally 60. We won't want to go more than 60 because a lot of things can happen between when you do the BSE and when the animal goes into a pen. And the reason we give a little bit of leeway is it gives them time to heal. So if we find something like, for example, that Nubian with the armpit swelling, we can give him some time to get his act together. We could treat him and then, you know, test him later, and he might pass. It also gives you time. It kind of prevents that scrambling for another ram or another buck. So it gives you time to find another one if you need. And then, you know, if an animal fails, you would want to retest them, to be perfectly honest. You want to retest them to make sure that they're ready to go. And another thing is that a VSE is not good for life. So this is the kind of thing, so a lot of things can happen. So someone had mentioned that one of their rams got a frostbitten scrotum. So things like that happen. So that animal, if you were going to try to keep him, you would need to test him. Even if you had a test last year, you'd want to test him this year. So, you know, every buck and ram every year. Okay, so that's all about BSEs. So now for kind of the last 10 minutes, just touch on some principles sort of biosecurity, which is probably you're all familiar with, now that we're in the global pandemic era. So you probably heard that term a lot, and it relates to animals as well. And so we're going to kind of cover disease screening, parasite control, general once over, and some basic principles. So this is a really good time of year to be introducing animals to your herd or flock. And mostly it's coming in the form of these guys. So you know, rams, bucks, you know, maybe you purchase some new ewes to add some genetic variation to your herd, but they're all a risk. And so when we're thinking about principles here of biosecurity, we're thinking about controlling the introduction or spread of infectious disease in your herd or flock. And, you know, we can think of a lot of different things. So people can bring diseases onto your farm, the feed truck, but really new animals and new animal additions are the biggest threat. And so, you know, the question that you need to ask yourself when you're considering, for example, if you're going to share a teaser with another herd or flock, you know, what diseases are you willing to tolerate, and what diseases do you potentially already have? Because that can, especially, for example, if you have chlamydia or Campylobacter in your herd, you probably don't want to bring naive animals into that, or you would want to separate them until you can get them vaccinated. So there's some considerations there as well, because you want to protect your new additions from the diseases you have. And so, you know, here's kind of a laundry list. So, you know, resistant worms, for sure, maybe external parasites, ringworm, orf. So this little kid here with his little orf, and this kid back here too. Foot rot for sure. Infectious abortions, we talked about that. Zocaceous lymphadenitis, so CL abscesses. OPP, so ovine progressive pneumonia, or CAE, which is Cacrian arthritis encephalitis virus, pretty much same virus, different species. And that one is a pretty serious one that can cause some real performance challenges. Johne's disease, so that's a chronic disease as well. So CL, OPP, CAE, and Johne's are all chronic diseases that if you bring them into your herd, you're probably going to slowly infect everyone over time. And then scrapie, which is very important, but no one seems to talk a lot about it. So again, you know, it's all about risk and risk tolerance. Like, what diseases do you have, and what are you willing to potentially tolerate?
Whitney, a timely question right now is, if herds that have ORF on the premises, when is the best time to vaccinate the lamb and kids? And do you vaccinate the ewes and does also every year?
Okay, great question. So ORF, viral disease, usually circulating within your adults, but adults become eventually immune to it. And so typically we worry about the youngsters. And typically we would wait. So it's the vaccine is no joke. It's a live vaccine. And so animals will get a little ORF when they're vaccinated. And so that's a scrape test, or a scrape vaccine. So you basically abrade the skin, you paint the vaccine on there. And typically we would do that at around 1 month of age in our lambs and kids. So we don't worry about adults. We worry about the lambs and kids, because we assume that it's circulating in the adults, and the adults typically don't have clinical disease.
Okay, thank you. And then, can Johne's transfer from cattle to goats?
Yes, absolutely can. So that's a really good point. Johne's, so the organism can go from, it's the same organism in cows and sheep and in goats. And so if you have cows and goats and sheep on your premises, you know, either knowing the status of those animals or trying to keep them separated, or at least keeping the manure separated, and making sure that we're not having, you know, it's fecal orally transmitted. So if we kind of keep the manure separate, but yes, absolutely, it's the same organism in cows and sheep and in goats. Yep. All right, so keep moving here. So, you know, what are, so again, getting back to risk, what are some kind of definitions of how you could mitigate that risk? And so one is having a closed herd. And so this is a herd or a flock in which there are no new additions. And this is pretty uncommon, especially with, I mean, if you want to have any genetic progress, you have to do AI or ET, and we heard how expensive the straw of semen is, and certainly lap AI and embryo transfer work is not cheap either. So there really aren't that many truly closed herds. So you know, the goal really is to have a mostly closed herd or flock. And so this is where there are minimal additions. And so what we would want to try to do is purchase animals from operations that we have also the same sort of disease status, and that disease status is known. Sometimes that's really tricky because people aren't necessarily willing to disclose all the time what their disease status actually is. So that's where quarantine becomes important, which we'll get to in a few slides. You know, buying animals in lots, or, you know, bringing multiple animals in at a time, and then not buying animals at the sale barn. So yeah, just don't do that. You never know what you're going to get when you buy animals at the sale barn. Okay. So to me, this is my list of diseases of most concern. And, you know, maybe you put ORF up here, you know, maybe you put ringworm up here. It all just depends on what you're concerned with. I think these are the most scary, mostly because foot rot can cause huge problems. The top three are all chronic infectious disease, and then resistant parasites, you might already have them. But that is not something that you want in your herd or flock, because it takes a long time to dilute them back out. And so when thinking about these diseases, how do we ensure that our new arrivals are free? And so we can think about the seller, flock, or herd status. So what do we know about that herd or flock? Are they like Yonis? It's very uncommon for a herd to test everyone and be Yonis free. It's same with CL, same with OPP, although there are more and more sheep producers who are doing that. We can also do some testing. So that's certainly an option. And then some of these we can treat. And so if we think about OPP, Yonis, and CL, we can test for all three of those. It can become quite expensive, and there are certain tests that work better than others for each of those diseases, but we can test for all of them. With foot rot, so we might know the herd or flock status from the place that we're going to get these animals from, but we can also treat it as well. And then resistant parasites, so same thing. So we can know the herd status. That's pretty hard sometimes with parasites. We can test, so we can certainly when that animal is quarantined or animals are quarantined, we can do some testing, and we can treat. And so, what else? So depending on where these animals are coming from, if they're coming across state lines, they're probably going to have to have a certificate of, or they do have to have a certificate of veterinary inspection. Sometimes they need a TB test, a brucellosis test. And so they should have been evaluated by a veterinarian before they left wherever they're coming from. And then another thing to consider is adding vulnerable populations to your herd or flock. So, pregnant animals, very young animals, it's, always a good idea to keep those animals separate until they kind of regain their full immune capacity. And so, what are we going to do with these animals? Well, quarantine them. And so what does this mean? This means we physically separate them, for at least 3 weeks. There's no really hard and fast rule here. I like 3 weeks because it kind of allows us some time to get some testing done, get some results back. And we want to do this in a pen or an area without contact to the herd or flock. Another important concept is we want this area or this pen to be a pen that we interact with less than we interact with the rest of the herd or flock, or that we always go to last before we go inside and wash our clothes. So on the right-hand side there, that's an example of a quarantine pen. So this is a herd that, a goat herd, a boar goat herd that does have some yonis, or at least have a few yonis positive animals. And what they decided to do is put those animals in this pen. And so this is a pen, you can see it's actually quite cool. They use a calf hutch there in the back, and then they have the wood, which wood is not the best. You want this area to be easily cleanable, and wood is really hard to clean in a lot of ways. So, wouldn't be my ideal setup, but it works for them and it works for this herd. And why do we consider this 3-week time period? Well, if you're going to test, so you take a blood sample and you send it to, so Washington State has a panel, the small ruminant infectious disease panel, and you can test for CL, yonis, and CAE or OPP. So it allows time for you to get that sample, send it, and get those results back. Shipping is stressful, so that 3-week time period will give the animal time to, develop a snotty nose, develop maybe develop ringworm, maybe develop foot rot, which maybe is optimistic, but it does give time if the animal is going to get sick. It also allows time to perform a fecal egg count reduction test. So we're talking about parasite control here. It gives us time to take a fecal look and see, how many eggs this animal is carrying, and certainly that depends on time of year, what we're going to find. It also gives us time to deworm them. And then it allows time for a spa treatment. So this is another time when we'd want to, trim feet. That also allows us to look at the feet to make sure that there isn't any foot rot there, and do any other things that you're gonna, maybe you're gonna do some external parasite control, for your new arrivals, whatever. It gives you time to do that as well. And so, we have herds that we work with at the university that really want to test for infectious diseases for new arrivals, but they pull the blood and then integrate the animals all throughout the farm. So that's not really doing what we want to be doing. We want to wait until we are sure that those animals are healthy, free of whatever diseases we're interested in, before we integrate them back into the herd. So if this is a buck or a ram, we want them to be free and clear before they go and mix with all of our ewes or our does. Okay. So lastly, here's just a summary slide. So, how do we ensure proper health? Well, we, ensure proper nutrition. We think about vaccinations that we might want to give our animals pre-breeding. We deworm them. So again, if you're interested in a long talk on deworming, let me know and I can point you that way. And certainly culling decisions should have happened at weaning, but if we haven't done that yet, this is the time to do that. The BSE, so what is the breeding soundness exam? When should we do it? So 1 to 2 months prior to turnout or use in our males. And really what is our goal here? Well, it's improving reproductive outcomes and profitability when we're only using satisfactory rams or bucks. And then, again, biosecurity, thinking about what is your risk tolerance. Maybe you have none, and, that's fine and that works for you. But really best practice is to quarantine test and treat new additions to really protect your herd or your flock. And so with that, if there are questions, I will take them. Stop sharing.
Whitney, we have a question that came in that I just can't answer. So
I might not be able to either. Okay.
So the question is external parasites control prior to breeding. Just concerned that there's not a lot of products on the market for sheep and goats that are on label. And then asking if porons are safe and should you use both porons and injectables?
Okay. It's a good point that we don't have a lot of products that are labeled for sheep and goats. I would err on the side of caution and not use products in pregnant animals. That would be my first thing that I would say. Injectable versus your pour-ons or your powders. I guess I would ask, what do you think you're treating? Because those products will treat sucking and biting lice differently. So I guess that would be my answer. You would want to work with your vet, figure out what the risks are, figure out what you have, and then use the products that would get rid of that. If I had to pick, one thing, pour on versus injectable, injectables. So if you're talking like injectable ivermectin, that will not get, or it will not kill certain types of lice. So, the pour-ons, I think, would be a safer bet if you're just going to use one product. I guess that's.
I guess I would echo that. I like pour-ons if you're going to do it. The issue for me with pour-ons is dosing. It always is dosing. I love having a scale and being able to adjust it. That goes with injectables too. It just seems to be more of a problem with the pour-ons. I'm just trying to be real careful not to say something telling you to use an off-label product without talking to your veterinarian. So that's really the advice, is you have to talk with your vet and work with your veterinarian. There's a lot of things they can do if you can diagnose what you have. If you can show this is what I have and there's nothing available to treat it that's on label, you've got some options. But really working with your vet's kind of the first option for that.
Yeah, and it's not hard. We have our vet students out there with tape, and they, tape the lice and they put it under a microscope and look and see what it is. And then we make a recommendation based on that. So it's not really anything fancy. It's just knowing what you have and treating based off of that.
So there's another question, Whitney, here, your opinion on what's the better wormer for goats. I know that's a big question, and then that's not something that, I don't know if we have time to get into that, but it's a conditional answer, I'm sure.
Absolutely. So I would answer that with whatever works on your herd, and to know that you need to know, what you have. So you need to do fecal egg counts. You need to know what has worked historically. Like that's a very, very challenging question to answer without having a lot of data and working with your veterinarian. There's not one best wormer. There's not, and certainly like taking or having the mindset of like, I'm going to use the strongest dewormer that's out there is not the best way to go, because then you're going to accelerate resistance. So everything that we do when it comes to deworming animals, whether it's sheep or goats, is to mitigate the acceleration of resistance and resistant worms. So that's a really complex question and complex answer. So I would, if you're interested, there are lots of resources available to learn more about deworming and dewormers. So wormx.info is the American Consortium for Small Ruminant Parasite Control, is a great resource to go and learn more. But I based on your individual risk, I would really encourage you to work with your veterinarian.
Yeah, and I would echo that. The key to parasites is to stop focusing on the wormer and start focusing on preventing resistance and building resistance to parasites in your herd using FAMACHA and culling animals that just can't make it. That's my opinion on parasites.
Please keep questions coming in, but I am going to have our poll out here available for you now. So there are 3 questions that we really value your input on, just trying to make programming better for you in the future. So your input is always really appreciated, and we will be sending a longer evaluation survey after this webinar as well. And that's an opportunity for you to give us even more feedback. So we love hearing from you guys, and we really do take the time to look through them. So Please answer the poll and the evaluation survey and keep the questions coming if they're out there.
Everyone's tired and wants to go to sleep.
I don't see anything coming in, Claire.
So I do have a couple comments, Whitney, because we raise goats just for 4-H. And I think like beginning and intermediate goats and the number of goats or sheep that you have on your farm makes a difference about how you want to treat them. Now, beginning goat producers and have a relationship with your veterinarian. Before you even purchase an animal, make sure that you have a veterinarian that you trust, that you have kind of vetted, that is able to answer the questions that you may have, you know. And you touched on it there also with resistance. When I first started worming my goats, I used the pelleted form, and I think, you know what, and that's okay because I'm a small producer. Now, if I had 15 goats, 20 goats on my property year round, I think I would have a different perspective on how to deworm and manage my goats. You know, we have these just here for 4 or 5 months. They're meat goats. They're 4-H. So I think that's the other thing too that producers need to keep in mind. And then I guess the other thing too is I would like you to touch just a little bit on resistance and what that is and why we change up medications and some of the things that we do on the farm. Can I just use the same thing I use for my cattle? So can you address that kind of a little bit? Resistance and using different products and keeping a health history.
Sure. I mean, I would refer people to the extension talk from, you know, two months ago and go listen to it because, you know, that is going to be much more valuable than me sitting here talking about resistance, but I will. I really like your comment, Colleen, that, you know, a lot of, you know, sheep and goat producers are very diverse and have different goals. And it's important that, you know, anyone that you're working with understands where your goals are, and kind of, you know, if your goal is to have 4-H animals for, you know, 5 months out of a year, that's very different than, you know, having animals year round, or, you know, having 1,000 ewes versus having 30. I mean, there's a lot of variation, and that's kind of, to me, that's one thing that makes it, you know, working with sheep and goat producers so fun is because there's such a diversity. So, all right, so talking about resistance. So, let's see. When we think about worms and internal parasites, you know, just like any other creature, when they breed, there are genetic changes. Okay, so when you know, over time, there are naturally worms that are going to be resistant to a wormer. So let's take fenbendazole for example. So we have fenbendazole, our white wormer. When we deworm animals year after year after year, there's going to be some proportion of the worms that are going to survive. And those worms we would consider to be resistant to fenbendazole. So, and what those worms do is when they breed with other worms and they create more and more resistance over time until all you have left are worms. So let's say like in 5 years, so we deworm with fenbendazole twice a year for 5 years. And after those 5 years, the majority of those worms might be resistant to fenbendazole. So therefore, that dewormer won't work anymore. So, you know, there's a lot of strategies that we can use. So we can use different classes of dewormers. So we have 3 different classes of dewormers. We have the white wormers, the yellow wormers, and then the ivermectins. And so the new information is telling us that we need to use those very strategically, and we need to, use information about the goats or the sheep. So what do they look like? Are they pale? What are the eggs telling us about their infection rates? And actually target individual animals for treatment rather than treating all the animals in the herd or flock. So, resistance is just that the worms don't die when they are exposed to a particular dewormer. And then over time, if we expose them to that same dewormer time and time and time again, we're just going to have a big proportion of the worms in a given animal that aren't going to die when we deworm the animal, and eventually then the animal dies because they are, Homunculus contortus, or the barbacle worm is the big worm that we worry about because it causes anemia in our sheep and goats, and those animals can get really sick and die from that. So again, I would encourage you, wormx.info, go listen to that extension talk. There's a lot of really good information out there on resistance that's probably a lot better than what I just said off the cuff at 8:30 at night. So there's a lot of resources out there for you to understand resistance.
Yeah, thanks. Wayne, would you like to mention some of the upcoming webinars that you're planning coming up a little later this summer and into fall?
Yes, we would like to do one on marketing. We'll very likely do something on marketing in August. Let's see, we're also considering discussing about buying your feed supplies for winter and the proper time of the year to be doing that. Because if you wait until into the winter to buy feed, especially forages, it's going to be very expensive. So we'll talk about relative feed value of hay and other forages, and how to try to get through the winter as economically as possible while really maintaining the quality of nutrition that you need for your animals. So those will be a couple of things coming up.
Yeah, those are timely topics this year. And again, another reason that we'd love to hear your feedback on our evaluations, because we do want to know what topics are burning in your minds coming up for some of our future programming as well.
I would just add one more, and that is then later in the fall, we'll also be doing one about preparing for lambing season, so that people will have as much knowledge as they can going into that time of year, rather than suddenly arriving there and having complications and not being able to deal with it. So probably in October or November, we'll be talking about the lambing season.
Great, so keep your eyes open for that. And we do have another question for Dr. Whitney here. What's the ideal time for deworming the flock against tapeworm?
Yeah, so good question. Tapeworms, so tapeworms are, usually it's a mite that's ingested in the pasture, and then it takes, the sheep or goat needs to eat that mite, and then it takes 6 to 7 weeks after that's ingested. So really, if you're deworming, it depends on your deworming schedule. If you're deworming in the fall, that should be sufficient. So, any dewormer so most of the dewormers are gonna work against tapeworms. I would encourage you to understand whether tapeworms are an actual problem in your flock. So that's something that we can take a fecal from your sheep or goats, a couple months after they've been out on pasture, and look for the eggs. So we can see those eggs in the fecal pellet of the sheep or goat. But really, if you're deworming in the fall, you should be fine. Yeah, that's what I would say.
I would add to that it's a debated topic whether or not they actually cause pathogenicity and whether or not they're actually a problem for production loss. I tend to think and I'll make sure that this is my opinion. I think tapeworms are easily visible because of how they're expelled on the back end and what they stick to. And I really don't think they cause production losses. If you're seeing issues with your animals and you're also seeing tapeworms, I would suggest you look for other causes as well that could be causing issues.
Good. So another chance to ask any questions here. Otherwise, we will wrap up. Okay. Oh, more time of the day is the question. So do you deworm the flock early morning on an empty stomach or in the evening after grazing?
Yeah, so most of the data supports when this is for roundworms. So we're talking our Homunculus, Ostertagia species. If we hold off, and this is only for certain dewormers, if we hold the animals off feed, the dewormer becomes more effective because it goes to the abomasum more quickly. And so, it depends on the dewormer that you're using. It depends on what you're trying to do. But there is some evidence to support that holding animals off feed for 12 to 24 hours improves efficacy of your dewormer.
Great, thank you. Seeing no more questions come in, I think we will conclude here. And thanks again for joining us tonight. And stay tuned for some programming focused on goats and sheep coming up in the future.